I was inspired to become a neurosurgeon by my father, who was the first professor of orthopedics at National University of Singapore. It's because of him I went to medical school. But during medical school, we had an unfortunate event where my father actually had a brain problem. He had a minor stroke and he had to be flown to the United States for surgery. He fully recovered, came back to work, and then his surgeon actually came to Singapore and gave a talk, and I was able to meet him. And he inspired me because he was able to convince me that neurosciences and neurosurgery was the frontier field where many difficult problems of the brain, the spine, and the nerves, which were previously unsolvable, were now treatable. The mission of the Singapore Brain, Spine and Nerve Centre is to provide high-quality neuroscience, researched and evidence-based care for patients with brain, spine and nerve problems. And the kind of patients that we see include brain tumors, including primary brain tumors that have started in the brain and brain tumors that have started in another organ, like the lungs or the colon and other organs, and then spread to the brain. We also see patients who have spine problems, including spine disc problems or spine stenosis or spine spondylosis or spine fractures and spine injuries that are pressing upon the nerves and giving rise to back pain and arm or leg pain or neck pain. The other conditions that we see include trapped or pinched nerves in any part of the body, causing pain, numbness or weakness. So there are many different ways in which patients can communicate with us and have appointments with us. This includes email, WhatsApp, phone calls, and once my administrative staff able to answer them quickly and get appointments early for all our patients, because we're concerned about having them get the best and right and quick care before major problems occur for them. So once we see them in our clinic, we try to quickly arrive at the possible diagnosis and the appropriate scans and tests they may need. And we can usually do these tests within a short period of time, let's say within 1 or 2 days, so that they don't have to wait too long. Once we've done the appropriate tests, we are then in a good position to help patients understand what the diagnosis may be and what the treatments are. So at the Singapore Brain, Spine and Nerve Centres, we support patients who come and see us with symptoms of headaches, neck pain, back pain, spine pain, numbness and weakness, and try to find out what is the cause, the root cause of their problems. There are many people who have these problems and symptoms but ignore them until they become more serious, or they're seen by, let's say, massage therapists and other non-medical, non-healthcare professionals, but cannot solve their problems. But it's very important for us to find problems early, so we encourage them to come have a consult, have tests and scans done, so we have an appropriate diagnosis for them. So for our patients, many of whom have headache or neck pain or back pain or arm or leg pain, numbness or weakness, it's good if they can come to see us early, because when we find problems that are early, a lot of our treatments are medical treatments or physiotherapy or supplements or exercises that do not require any surgery. Patients who come a bit later with weakness in the arm or leg or loss of some of the senses such as hearing, taste or smell may have some tumors or other conditions such as serious pressure on the nerves in the spine that may require interventions. But of course, fortunately now, because of the advance of technology, there are less invasive day treatments using the help of robotics and microneedles and special energy treatments higher than just lasers that can be done as day treatments so patients can go home the same day. So first-time patients do not need a referral to come and see us. I recommend that they turn up in our clinic with any appropriate scans and tests they have had done in the past, because this will be helpful for us to assess them and arrive at a preliminary diagnosis and then do confirmatory tests to arrive at the complete and appropriate diagnosis of their problem. problems and a treatment plan that can be formulated. So when patients come to visit us, what we want to do is to let them know we will treat them with empathy, sympathy, respect, and try to understand and listen to them about their problems. And we spend anywhere between 15 minutes, even up to an hour, to understand their problems, do a clinical examination. So we check all the nervous system issues with them and arrive at some kind of preliminary assessment towards the root diagnosis of their problems. Subsequently, we may need to order some tests. Of the common tests that we do include MRI scans of the brain, the spine, and the nerves where appropriate. And our admin staff can usually help them and assist them in terms of any insurance coverage and getting the appointments as early as possible. And we also give medical leave for those who need it, so they can take time off from work, come for our appointment, and also have time off to get the tests and scans done. There are certainly people in Singapore and the region who have problems such as headache, back pain, neck pain, spine aches, pain, numbness and weakness of their arms and legs, who go and seek treatment from non-professional healthcare providers, get massages, take simple pain medicines, and they have chronic problems. But it's important for us to help them understand that we are available so that we can help them make a proper diagnosis of the root causes of their problems and help them avoid serious diseases that may cause worsening of their problems in their future. So we accept a wide range of insurers and insurance, both private insurance and corporate insurance. This includes NTUC, GE, Singlife, AIA, Prudential, and many others. So my staff actually works very well with patients to check on their insurance and assist them so that the insurance coverage can be used for their diagnosis, medicines, and treatment. We try to make it convenient for patients to reach out to us. They can do this in many different ways. They can go to our official website and there's a booking form which they can fill up. There's also information on our WhatsApp because there's a WhatsApp account direct to us for appointments. You can call our clinic and get appointments, and an email if you wish to get appointments with us. The main clinic is located at Mount Elizabeth Medical Center, which is in the middle of Orchard Road. We are next to many different hotels in the area, next to Far East Shopping Plaza, which is a prominent landmark. So it's quite easy for patients to find us. There are, of course, MRT stations, bus routes, and Grab and other mechanisms of coming here and finding our clinic.